Please welcome our speaker for this next session, Dr. Jim Campbell, Director of Workforce Planning at the World Health Organization. Please, let's make him welcome.
Assalamu alaikum. Good morning, everybody. What a pleasure to be in Riyadh, in the Kingdom of Saudi Arabia, and especially on this discussion, the Global Health Exhibition 2025, and today's event sponsored and supported by the Saudi Commission for Health Specialty on an issue which I feel is one of the most critical discussions that I have with ministers of health around the world, which is the health and care workforce, the leadership of it, and anticipating what is necessary. We've just heard from Professor Aus Al-Shamsan. He spoke about the passion and professionalism of the health and care workforce to drive equitable access to services. I'm going to add a few more perspectives around, firstly, a global perspective from Geneva. Secondly, some of the issues that we talk about, the policy window, the policy context, and then into partnerships, and partnerships that generate the ambitions that we have. And that will then set the scene for some of the panel discussion momentarily. Perspectives. Many in our industry are trained in Pathology 101. We are diagnosis. What is the problem? What is the issue? What is the disease? What is the illness? And it's very easy, therefore, to start thinking about, when we talk about the global health and care workforce, some of the negative issues, some of the challenges, the problems. The 11 million shortage of workers worldwide by 2030, the distribution, the equitable access, the pay gaps. But actually, we should also look from the positive perspective. Global healthcare is making tremendous advances worldwide. We have now over 70 million health and care professionals working in our economic sector. We're one of the fastest growing employment sectors, opportunities for women and youth. 2/3 of our workforce are women. Post-COVID-19, we're making tremendous progress on life expectancy. It's back up to higher levels. We are seeing transformation through digital tools, technologies, augmented intelligence, artificial intelligence, which can drive progress. And it's important that we keep a balance in our policy perspective to make sure that we're looking about not only the problems, but also what can we learn from each other, and how can we apply that knowledge, that learning, that evidence to make improvements, which is the policy context that many of us are facing. And where are we today in 2025? We are 10 years into the Sustainable Development Goals. They will end in 2030. From next year, 2026, until through 27, 28, there will be a new global policy discussion on what will replace these Sustainable Development Goals. What ambition will we have from 2030, 2040, 2050? And yet, we're in a moment in time around the world where that policy window is a challenge. Multilateralism is being challenged. The high-level meeting in New York on the heads of state failed to achieve consensus on how to address non-communicable diseases. And so we have to, therefore, in that policy context, look at the opportunity beyond the government leadership, beyond the government stewardship, and the role of all stakeholders in our work. The role of associations, of unions, professional bodies, the role of the private sector around the world to be at the policy table looking for transferable lessons, knowledge into practice. And that's some of the work that we're seeing from the Saudi Commission for Health Specialties as they convene and engage with partners worldwide. And that partnership, the third point here really to drive home, is what we've seen. We have the World Health Organization is a partnership of countries, of jurisdictions around the world. In May this year, that partnership agreed a new resolution to accelerate action on the health and care workforce by 2030. It put forward a set of discussions on the ethical recruitment of international health personnel and talked about the health economy as a major human capital sector with positive externalities: jobs, gender, health, equity, economic development, economic empowerment. And really saying that these partnerships must be central to all of our work that we take forward. Those partnerships, we see also examples here in the kingdom. This partnership, as we walk through this exhibition center to come to this leadership event, seeing all the different stakeholders that are part of our health and care economy, our health and care model, and ensuring that there's an opportunity for that partnership to really come together. We've seen that in the partnership work around education here in the kingdom, the knowledge, competency-based education, knowledge transfer. We've seen that in its work around credentialing and digital data to make sure that there's opportunity for mobility and movement around the world, including mobility to the kingdom. And we've seen that partnership as well when it comes to ethical recruitment of international health workers. And that point is very real here in the kingdom, in the Gulf states. If you look around the world today, 10 high-income countries are responsible collectively for about 2/3 of the world's migration of doctors and nurses. 10 countries, 2/3 of the migration flows. And so partnership, responsibility, ethics is a key issue here to ensure that we leave no one behind. The benefits of mobility are mutual, that the benefits of bringing expertise in from countries around the world is an exchange of knowledge in dual directions. And we see that openness from the Commission and the Kingdom to be looking at those partnerships here. And that's really, I think, what the opportunity is going to be as we use this event here in Riyadh, the Global Health Conference, this Leaders Summit, to think about what do we do next. Those issues around perspective, the issues around partnership, and the issue around opportunity for our leadership to excel is critical. The health and care systems of tomorrow and the health and care workforce that are critical to deliver those systems will not be built by chance. At least they must not be built by chance. They must be built through leadership that is committed to working in partnership and is united in its purpose to promote the public policy ambitions. And those public policy ambitions from a global perspective really have equity at the core, so that we leave no country, no community, and no patient behind in being able to access health services when it's needed for all people of all ages. Thank you once again to Professor House and his team for this opportunity to be talking with participants of the Global Health Exhibition. I wish you excellent deliberations. I thank you. Shukran.